Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ NV, Jess Hilarious, Charlamagne the Guy. We are the Breakfast Club. Now we got a special guest in the building. If you don't know, June is Men's Health Month awareness, prevention, education, and of course, community. And we have a special guest, Dr. Joseph A. Puma. Welcome back.
Mental Health Month, too.
Yeah, Mental Health Month.
Yes.
Yeah. How are you feeling this morning?
It's great to be back, DJ Envy, Charlamagne. Thank you again for having me.
Mm-hmm.
I don't think we can ever have you enough, Dr. Puma, because, you know, me and Envy, we've done every single cardiovascular test there is to do. I tell people all the time, you know, it's the Soaring Heart Scan that really put my mind at ease, which helps to ease the anxiety. And with so many people dying of heart, you know, issues, I don't think we can ever have you on enough to talk about it.
Well, you're very kind. The two of you and iHeart have done an amazing job partnering with us to raise awareness, especially in underserved communities, especially black men, to raise awareness about heart health, mental health. And, you know, from my perspective, mental health is heart health, since so many people with anxiety and stress often have symptoms that they think are their heart. So I want to thank you because you've made a tremendous impact in the community. And at Soaring Medical, all of us are just trying to do our part.
Now, for people that don't know, just tuning in, maybe doesn't know Dr. Joseph A. Puma is, or didn't hear you on the radio before, break down what you do and how you make sure that people, you know, can have a long-lasting life.
So at Soaring Medical, we're an independent practice, which is a large independent practice, which is very unusual today. As you know, since the Affordable Care Act, most doctors now work for hospital systems. Healthcare is pretty much directed by administrators and managers. And there's a lot of dissatisfaction. It's difficult for patients to get access to care. So for the past 10 years, in this last part of my career, I've worked hard to increase access, develop the highest quality technology, and interestingly, we have the most advanced 3 to 4 minute coronary CTA scan we call the Soaring Heart Scan, in part because we have won an award now for 5 quarters in a row having the highest quality heart scan.
Wow.
One scan, 3 to 4 minutes, 99% accuracy, unrivaled, unparalleled. No one else in the city or in the surrounding areas has it. And so really the key, DJ Envy, is to try and develop access points. So the way our practice works is we have offices in all underserved communities. We're able to get demographic data, actually, comparing patients who have disease and aren't getting it. And the reality is disparities in care are real, particularly in the black community. And so our physicians are in these communities every day, including myself. And then we have our flagship ambulatory surgical center. Our goal is to keep patients out of the hospital. Recently, we've partnered with this company called Superscripts NYC, and we're now, we went live last night, the first healthcare marketplace. So if you go to our website, we're bringing forward transparent pricing, right? How many times you hear people go to the hospital and then they get home, they don't know what they had, they don't know what it cost, then they get bills, then they find out the anesthesia wasn't participating in their insurance, and 30 days later they're in collections.
Right.
And with our new process online, you put in your name, your date of birth, and your insurance ID, and this company is able to let the patient know what their insurance is going to pay, what their copay is, what their deductible might be, and we're transparent about what our price is.
I was going to ask you, too, because, you know, I've done the Soaring Heart Scan. How often should you get it?
So that depends.
Okay.
That depends on what the results are. I like to break the results down into 3 simple categories.
Okay.
Normal coronary arteries and 0 calcium score, like DJ Envy,
Yes,
if you
sir.
don't mind me saying.
Yes.
And so in 8 years from now, he can come back in and get another one.
I'm going to come back a little faster because I get a little nervous every
But
once
his
in a while.
risk, but with that scan, DJ Envy, your risk of a heart attack, stroke, or death is the lowest it could possibly be. It's less than 2%. Then we have the mild to moderate. There's calcification, no obstruction, no blockage in the arteries. But in those people, we get aggressive with risk factor modification, blood pressure, diabetes treatment, cholesterol treatment, especially LDL, keeping it as low as possible. And of course, I always say these things and exclude diet and exercise. Diet and exercise are key, right? That should always be the building block. But in those patients, probably every 3 to 5 years, and certainly if at any point they develop further symptoms. And then we have patients with severe disease. Mm-hmm. And typically those patients end up getting additional medication and then revascularization, either a stent in one of their arteries or heart surgery.
So I should come back in 3 years is what you're telling me?
Yes.
Okay.
Now, Doc, have you ever thought about doing a mobile truck?
When I lived in North Carolina, I actually did have a mobile truck. I was on faculty down in hospital in Durham, North Carolina, mm-hmm. and I was part of the community faculty. So we would go to these small rural communities, and you're from Moncks Corner in South Carolina, and North Carolina is very similar. You got kind of these cities, but you go 30 miles outside the city, and you're in rural area.
That's right.
And we used to bring health care to communities as far as 150 miles away, and that's pretty much how the model I followed when I moved mm-hmm. back to New York.
I was asking because sometimes people just can't get there or they're too scared, but I always think about how people say sometimes we got to come to where you are. So I could just
where they are.
Yeah, so I could just imagine if somebody in Brooklyn, they have a big festival and there was a truck there or a mobile where they can do it there, because a lot of times people are scared.
What does the price-given insurance mean?
So, recently I read an article that rapper Fat Joe has taken on this idea of transparency in healthcare mm-hmm. Prices. Mm-hmm. If you go on any hospital website, do you know what it costs if you need a procedure?
Too much.
If you go, but you don't know the number.
Yeah.
When you buy your plane ticket, you know what seat you're going to sit in.
Right.
You know the quality of the airline, mm-hmm. the rating, and you know what it's going to cost, and you pay for it right at that point. In 2021, there was a presidential executive order that was followed upon in 2022, as Fat Joe noted, that hospitals are required to make the costs of their services transparent. And unfortunately, few, if any, certainly none in the New York area, I've checked every website, are making it happen. But at Sovereign Medical, we're leading the way. We want to empower patients. We want to give them access. So further to your point, certain services we want to bring right into the community. Certain services, the technology or the equipment so expensive that maybe we need to look at putting it on an 18-wheeler or something, or in a truck and make it mobile. But sometimes we can only have it in one facility. But the key point is, people spend a lot of time on the internet searching. They're looking, right? They don't know. They're trying to educate themselves. And we hope if they come to our website, they're going to see easy access, high quality, transparent pricing. You put 3 pieces of information in, and soon we'll have a short video to show them how to do that. But it went live last evening, and they'll know exactly what their insurance is going to pay and what it's going to cost them.
What age should you start checking your heart?
If you have symptoms, any age. One of the reasons, actually, I appreciate the question, but one of the reasons I wanted to come on today was I wanted to congratulate Charlamagne on his new book.
Thank you, sir.
And all of us at Sovereign Medical are really proud of you and appreciate all you're doing. And we're trying to take the small talk out of taking care of patients and interacting with people. We're trying to have those honest conversations. One of the passages in your book you talk about, and God, you're so honest and open. You talk about when you would, drive into Little Duval's concert, I think in Orangeburg.
Yeah.
And you ultimately found that you had a panic attack, but all those symptoms were like a heart attack.
Yeah.
And you were only 30 years old?
Yeah, 31, yeah.
Right?
Yeah.
At the time. So the point is, if you don't feel good, seek attention. There's a reason for it. But if you're feeling fine, then I would say men over 40 and women 5 to 10 years after menopause, typically, unless they've been long-term smokers, have diabetes, or have high blood pressure, then they should be coming in regularly to be seen anyway.
I don't even think you should wait until you're having symptoms. I think you should just go do it. And the reason I say that, because, you hear stories, you be like, oh, such and such passed away. And you be like, damn, they passed away, how? And they just be like, heart failure. That's literally all it'll say. Like, cause of death, heart failure, heart failure. I'm like, and in my mind, since I've done, tests like the Soren heart scan, I'm thinking, did that person even go get any type of test?
No. And the reason is when you hear about these 40-year-old men, 50-year-old men that die suddenly, and we see a lot of it in the news, every week we see it. They don't know they have heart disease. They haven't, even if they've gone to a physician, they haven't had the proper testing. And 1 out of 3 people who have a heart attack, that's their first sign of a heart attack.
See that?
That's their first sign of heart disease. So they just don't know. But in terms of screening, the problem with screening testing in general is, it's an economic issue, right? If you have everybody screened, what's the yield going to be? How many people will you find disease? Now, that doesn't mean you shouldn't go to the doctor. Get your blood pressure checked. Know what your cholesterol profile is. Know if you have diabetes or pre-diabetes, right? But that's part of what we're doing. I have to tell you, reading your book is really inspiring us. It's making us feel like we're on the right track. We're trying to get rid of the small talk. We're trying to have more honest conversations with people. We're trying to empower people, give them access, and it's not easy to do. I mean, I'm sure we don't succeed every day, but I can promise you we're trying real hard at Soren Medical.
And you want to do something special for all the people that book appointments, correct?
Well, we're looking forward to the 18th of June. That evening, we're going to have an event. We're going to have a support your book launch with a book signing event and festivities at our flagship office at 120 Wall Street. The conversation will be about the book and how it can benefit and help improve any organization's communicative and interpersonal structure, the downside of small talk in organizations. In addition, that evening, those who attend will get a signed, autographed, limited edition copy of your book, and we're proud to do that. And in addition, for the next 500 people who come to Soren Medical, we're going to give them a free autographed limited edition copy of your book. So we're glad to support you. We appreciate all you have done, and you, DJ Envy, for the community, for people's health care, for being an advocate, and we're just trying to pay a little back and a little forward for you.
You hear what Dr. Puma said. So everybody who be calling up here all the time asking me for copies of my book, if you're one of the first 500 people who book their heart health checkup with Dr. Puma, you'll get a signed copy of my new book, Get Honest or Die Lying. You can book the appointment by dialing pound 250 from their cell phone and say the keyword live longer repeat. Just dial pound 250 from your cell phone and say the keyword live longer repeat. And you'll get a copy of my new book, Get Honest or Die Lying, courtesy of Dr. Puma.
That's right.
And what the event is June 18th. What time again?
6 to 8 p.m., June 18th.
At the flagship location?
Yep.
What's the address?
120 Wall Street on the corner of South Street.
That's right. Well, we appreciate you for coming
always,
in. And
Dr.
you're always invited up here. I mean, this is something that Charlamagne and myself talk about all the time, and making sure that our community gets checked out. Because the most important thing is prevention. And if we can prevent some of these diseases that we hear about and some of these problems that people have when they pass away, we want to make sure that we can. So thank you so much, Dr. Joseph A. Puma. Appreciate you for joining us this morning.
Thank you, DJ Envy. Thank you, Charlamagne. And thank you, everyone at iHeart.
All right, it's The Breakfast Club. Good morning.
Wake that ass up.
Early in the morning.
The Breakfast Club.